All right, so today our main focus is on how we can extend Test and Stay, the Test and Stay program, to out-of-school time programs. And I'm really pleased to be joined by Caitlin Molina, the Deputy Commissioner from the EEC, from the Department of Early Education and Care. And Caitlin will introduce herself in just a minute. But I always want to remind you, the team that is predominantly working together on this is listed here on your screen, and I'm sure that we'll be able to take some questions. We're not all here today, but most of us are. And so if there are other questions that have popped up, I know we'll have some time for this at the end, because we don't anticipate that our webinar today will take the full hour. So let's just jump on in. Caitlin, I'd love to have you just kick us off, and I'll advance the slide when you're ready.
Yeah, thanks everyone. My name is Caitlin Molina. As Russell said, I'm the Deputy Commissioner for the Department of Early Education and Care. I came to Massachusetts just a few months ago. Really excited to join this group here today. And I just also want to reflect and say, as a mother, but also a state administrator, I am really grateful for the work of our school leaders each and every day to provide and support in-person learning for children. I could cry. I'm so grateful for the opportunity for my children to participate in in-person learning each and every day. So it's really a privilege to be among you today, and thank you for your participation and your support. So I'll start with EEC at a glance, which is a bit humorous since I've only been here for a few months, but EEC nationally is a leader in the fact that it's a dedicated office specific to early learning and support for early education for Massachusetts' youngest learners. And so this was brought together in 2005, and we prioritize childcare, but also do a lot of investments in workforce supports and technology enablement to support educator growth and achievement. Broadly, our agency licenses about 9,000 early education and care programs across 5 regions in the Commonwealth. One thing that I think is important to highlight about EEC affiliated programs for the group here is that EEC is the funding that we administer to support our child care programs comes from the Administration for Children and Families. The Child Care Development Block Grant, which administers this funding, has some of the highest standards for health and safety. And so one of our charges as EEC is to conduct annual monitoring of our licensed facilities and our certified facilities to ensure that our programs, our operators, and our educators are adhering to these high quality standards for health and safety. Through our mixed delivery system, so out of school time programs, early education and care, pre-K, all of these services, we have the program capacity to serve about more than 230,000 children across the Commonwealth. As of November 9th, when we looked at what the implications of this policy in particular might have for districts across the Commonwealth, we do have, and I see there's a typo there, we have about 1,713 out of school time programs in our system, our licensing system, with a record, meaning that these could be operating in school buildings, they could be partnering with school buildings, but these are EEC affiliated. So they're either receive funding or are subject to our annual monitoring visits. These are out of school time programs that predominantly serve school age children in before and after care. And these programs specifically, our out of school time programs, have the capacity to serve over 84,000 children in the Commonwealth. So I bring this information to you recognizing that we often share the same students. We see them throughout different parts of the day, but our collective vision and our collective priorities for supporting child education and growth and development is very much similar. And we have an opportunity to really make an impactful difference with the policy expansion that we're previewing today. I will also say that surprisingly, when most people think of EEC, they think of us as supporting young kiddos, which we do, but 37% of our licensed slots are for out of school time programs across the Commonwealth. So as many of you know, as working parents, the 6-hour school day does not always cover the needs of our families. And so out of school time programs provide that wraparound care if districts are unable to do so. So EEC at the bottom, you'll see the graphic. We often talk about ourselves as an agency, but we support provider organizations who then employ thousands of educators and support thousands of families in accessing those high quality services and supports. Not sure who's driving the deck, but we can move to the next slide.
Excellent. And Caitlin, I really appreciate that. I think that was such a good foundation for this presentation. And in particular, what I really want people to hone in on is this idea of EEC affiliated. And I know that Caitlin's going to come back at the end to talk about that a little bit more, and how you can figure out and determine whether or not a program is EEC affiliated. So that's a really important point, and we can certainly answer any questions about that as well. So just a quick, I can get control of PowerPoint again. So the test and stay program and how it fits with out of school time offerings as well. Just want to remind everyone that the current test and stay program, as we all know, really allows schools and districts to have that safe, continual physical presence in our buildings, and really minimizing that disruption if there's a COVID positive case in the school. So those individuals who are identified in the school are able to remain in school using test and stay as a safe way, as a safe alternative to quarantining. And then as long as those individuals are asymptomatic and they are meet the definition of a close contact, they're able to just maintain that safe in-person learning, which is what I know we all want for our students. And we're frankly really appreciate the success we're having with it. We have more than 100,000 school days saved just this school year alone because of test and stay. And it's really your work that's making that happen. And I just think about, even my own son, when I think about that volume of days that could have been missed, we just know how deeply and how negatively learning would have been impacted if those 100,000, if our students missed 100,000 days. We just know how much further behind they would be as a result. And we just don't want that for our kids. We want to keep them accelerating. So just always want to ground our conversation in the definition of a close contact, and always reminding ourselves that the definition hasn't changed. It's just what we do about it. And again, so what we're talking about today is an expansion of what we do about it. So we know, and I won't go over this in great detail because we've talked about this a lot in the past, and I think you're all living it. But just that reminder that, the definition of a close contact hasn't changed. It's really about, how we are expanding the use of test and stay to individuals who are identified as a close contact, either in school or in an out of school time program, if the parties decide that they want to make that happen. So let's just talk a little bit about how this could expand then to out of school time programs. And like Caitlin said, we just know that for many of our students, that the school day really feels like before school, during school, and after school in some combination of any of those three ingredients. And we're really focusing, like we said before, about EEC affiliated OST programs. And it's really important to note why. And like Caitlin said, the standard for safety that EEC sets for its affiliated programs mirrors the standards that we set and are very similar to the standards we set in our schools. And so when we consulted with our close colleagues at DPH about this, we all agreed that because the mitigation strategies are similar, that we felt comfortable saying that in the EEC affiliated OST programs, we could extend the idea of test and stay to students attending before and after school programs. So we just, having that coordination occur would be really essential to making this happen. So we are adjusting the policy. Lauren is putting in the chat, and then also on our website, you can have access to the policy, which is the basis for this PowerPoint. So everything we're covering today is really in the written policy that you can have access to and go through at your convenience to see how all these pieces fit together. But really the idea is about, through increased coordination between participating schools and EEC affiliated OST programs, we can extend the benefit of test and stay to students who are attending those EEC affiliated programs. And so it's really important to note that last bullet, that no district is required, an OST program is required to take advantage of this extension of benefit of the policy. You can decide, does this work for you? Do you have the capability of making this happen? We certainly are grateful for your interest today, and we hope that we've worked to really streamline the process as best we can. But a key thing that would need to happen after this conversation is, if you are interested, there needs to be obviously some discussion between the district and the OST program to determine and talk about the next steps that I'm going to lay out for you in a second, so that you are able to work together to implement them. And there are a few really important details to go over, so let me dig in there. Caitlin, before I continue though, is there anything that you want to add about what I've said so far?
No, I would just reiterate that when consulting with our experts at DPH, there was a very prescribed conversation where we talked about expanding this program to include EEC affiliated out of school time programs. And I want to acknowledge the fact that only a subset of EEC affiliated programs are going to be able to participate in this program. So there was very set demographic criteria that enabled us to make a decision regarding out of school time programs. Broadly, all EEC affiliated programs that serve infants, toddlers, preschoolers, they are not able to access the benefits of this test and stay program because the composition of the services they are delivering look entirely different than what our out of school time programs are offering. So recognizing that there were some shared services between out of school time programs and districts, and that the delivery of services often mirrored what you all are delivering in schools, we felt like there was an argument to be made to include and expand that policy to reflect that model. So out of school time programs, traditionally, when they're doing before and after school care, many of them are setting up seating charts similar to how school districts do to support after school learning and homework time. So there was a little bit more confidence in the environment of out of school time programs. I say that because this is not an invitation for all EEC programs to then participate in test and stay. This is a very dedicated pilot supporting an expansion of test and stay to include out of school time programs.
Yeah, really appreciate that distinction. And we'll be glad to answer any questions about that too when we get to the Q&A at the end about which particular programs does this apply to, because that will be important. But by and large, the programs that you have strong existing relationships with are very likely to be the ones that this would apply to. So the really key thing to making this work is about information and record sharing, because ultimately what has to happen is that if there are students who who are identified as close contacts in school, right? They've been exposed in school, and they attend an EEC affiliated OST program, there would have to be communication between the district or the school and the OST program to talk about that student as, revealing medically sensitive information to the OST program. And, many of you have, and, when I was working at the school level and even at the district level, I know we had such very, positive and ongoing relationships with our OST programs. And so, that might be occurring to some extent right now, but we want to make sure that we protect everyone as we move ahead. And so if you are having conversations talking about, who's identified as a close contact between the school and the OST program, we need to, just tweak that and make sure that we have consent to do so before we're having conversations about students, privileged medical information between the school and the OST program. And so by getting parental consent, there could be information that would be shared between the school and the OST program, such as COVID-19 testing results, who are the close contacts in the school, and who are close contacts identified in the OST program. So those three pieces of information we've actually included in our consent form for you to use with your families, so that it's very clear that that's what parents are consenting for, is this type of information to be shared. And we just really want to make sure that we're doing that in a way that, again, just keeps that confidentiality of student records really at the forefront of what we do. I know that it's you take that so seriously already, and we just want to make sure we're giving you the tool to use to run this expansion well. And so again, the OST program is able to get this information as a result of having the information shared between the parties. And that partnership, I think, is just so important on several levels between the OST program and the district, as well as the local board of health, to support contact tracing. We just know that, when I know Caitlin and I talked about this, we really conceived of it as being a very strong three-way partnership: the school district, the OST program, and the local board of health. And so, we just, by working together, we think that we would be able to, just overcome any operational hurdles, so that the three organizations working closely together can do that. And that last bullet, I think, is just want to hone in on that again, that we really have to have that parental consent written consent in order to have that disclosure of information between the OST program and the school district, and that it works both ways. Caitlin, do you want to add anything more there, and particularly about any recommendations for the OST programs, that second to the last bullet, that you might have for OST programs?
Yeah, so the local board of health has already been working closely with a lot of our out of school time programs who have either experienced or reported a positive COVID-19 case. And a lot of what triggered our decision to coordinate across DESE and EEC was a realization that with this shared services, it was likely that there needed to be some communication between the two entities, irregardless of test and stay. So recognizing that out of school time programs and schools are doing screening, they're looking at health symptoms, they're isolating children who are sick, they're likely contacting parents or guardians if a child displays symptoms, that creating a consent form to allow for that information sharing would really serve multiple purposes. It would support the work that you're already doing, but it would also offer an opportunity to consistently and more effectively align test and stay to include those children that are attending before and after school. Out of school time programs are very aware of the CDC guidelines. There are specific CDC guidelines that are endorsed, but also supported in our messaging around social distancing, making sure that there are minimum health and safety standards adhered to at all points within the out of school time day to ensure that there is limited transmission of COVID-19 in those settings. And so out of school time programs, particularly those who have raised their hand and said, we would like to be included in test and stay, have already committed to us and will commit to you all an effort to cohort children based on grade level, particularly for those that test positive or who, if they test positive, they would be excluded. But for those who are close contacts of a positive and are participating in test and stay, there is a commitment from out of school time programs to work collaboratively with districts to ensure lowest risk possible in terms of forward transmission, should in fact the student end up testing positive.
Yeah, Caitlin, I think that point that you made about the consent being useful beyond test and stay is such an important point to make. I know that early in the school year, we did hear some concerns about that, how much that lack of information sharing between OST programs and school districts was, creating a lot of stress on all parties. So the student who was a close contact, who should be quarantining otherwise per our guidance, and is still going to an OST program. We just knew that, we were hearing that, that was creating a lot of concerns about, the parent didn't inform the OST program that the student was a close contact. And so having the consent form, we think, is also useful just being able to share information that will help operations on both the school side and the out of school time side as well, that, just for both two-directional, right? And so we were really careful to make sure that this is two-way consent that parents would be permitting here, so that we can go both ways.
And I think the out of school time inclusion in this policy introduces an opportunity to have, I think there's a public health argument to be made that having an additional set of eyes or additional entity doing the screening and supporting students in their learning and participation in the test and stay could further prevent forward transmission of COVID-19, because we are adding additional layers of screening and support to the students who are participating in this program. So a lot of out of school time programs, when advocating for their inclusion, specifically stated, we are also doing screening. We're also looking at symptoms. We're also supporting children in navigating COVID-19. And so having that additional layer of mitigation really strengthened our opportunity to pitch an expansion of this program to those EEC affiliated out of school time programs.
Definitely, definitely. And Caitlin, when you're saying screening, I just want to be clear for our audience. We're talking about health screening, looking for symptoms as opposed to testing. The testing is done in the school, and I'll say more about that in a second. Um, and I just want to make sure that, that helps for clarity for everyone as well.
Yeah, and I think we'll get to this in the next couple of slides, but just to confirm up front, EEC has not endorsed or supported any on-site testing within its EEC affiliated programs. So childcare programs by and large are not conducting testing or administering testing at their sites. EEC has supported pop-up sites where programs, families, educators can go to access PCR tests, but at this time, we do not have any programs that we have supported through funding or regulations administering COVID-19 tests to children and families at their location.
Right. Thanks so much. And so I think that's a great segue into what does implementation look like. And so as long as we have that signed consent, and again, just want to double down on the idea of it being a signed written consent that allows for that information sharing to occur, then we can use it to EEC affiliated OST programs and districts can use it to, have that discussion and share that information. And we want to make sure that, both parties are aware of that we have signed consent, that it's, kind of conveyed between the parties. Let's just dig in a little bit more. So kind of going to what Caitlin was just saying, the testing will continue to occur in the schools, right? These are students who are already in our schools, already consented to participate in test and stay. And so we're not adding to the number of students who can participate. We are saying that two things are occurring with what we're implementing here. One is we're giving very clear license that those students, if they're participating in test and stay in school, are cleared to participate in before and after school programs. And we're also making it clear that if a student is identified as a close contact in and out of school time program, if they're exposed in and out of school time program, they can then participate in test and stay in school. And so that's the kind of the two-way element of this. Caitlin, am I missing anything there in terms of the testing will occur in the school just as it is now? The OST programs will not be testing students. And the two things that this then allows, again, the student to participate in the OST program if they're exposed in school or in the OST program, and if they're exposed in the OST program, to be able to participate in test and stay in the school.
I would just highlight the bi-directional piece that you flagged earlier on, Russell. For an out-of-school time care provider, this also enables them to accept a child who is participating in test and stay, but has previously not been able to attend out-of-school time care because our policies at EEC do not allow for that, right? And so bi-directionally, we are also allowing children participating in test and stay to now attend before and after school care as a result of this expanded policy.
And Caitlin, I think it's also important for us to note that this does not yet include the staff and OST programs. And so our school district partners who are listening right now might be wondering, are there going to be people from the OST program coming into this school to get tested? And right now, that is not the case. We're really talking about an expansion for the students. But do you want to just add anything further about that right now?
Yeah, it would just be for the students. And we did look at this particular grouping. And while the majority of educators have become vaccinated, we think that the volume of those that would need sort of outside testing at this point would be very, very small. It would not be something that we would need to operationally solve for with this expansion. But the expectation, as Russell said, of districts is to include children who they are already serving in the test and stay protocol and offering to administer those tests to those existing students within their ecosystem.
Yep, exactly. Thank you. Thank you. So, and then, the contact tracing and case investigation process remains the same in terms of who's doing that work. And we certainly, are glad to follow up further on that as well. Just really appreciate that collaboration between the three parties, the schools, the EEC affiliated OST programs, and the local Board of Health to identify, who meets that definition of a close contact. And we just, if a child obviously does test positive, they have to complete their isolation period in order to return to school or to the OST program. Again, that's, I think, those pieces in particular, but just wanted to reiterate them. And like I said, this is all in the memo that's available now on our website. So Caitlin, just a few final quick tips and reminders and resources.
Yeah, so I think what's most important for the audience here is to know that not everyone who advertises themselves as an after-school program or provider is necessarily EEC affiliated. So it's really important for the purposes of this policy to confirm that the out-of-school time program is either approved or licensed by EEC to operate. And you can do so with that link that's on the first bullet. That is what we call our consumer website. We are federally required to maintain that public-facing directory of programs that are either licensed, funded, or certified by EEC to operate. You will see at times there will be ballet schools or soccer clubs that will market themselves as before and after school care. It is very important for the purposes of test and stay expansion and inclusion of out of school time programs that you verify that this is in fact an EEC affiliated program. The reason to do so is a couple of reasons. Like, we are heavily regulated and monitoring our out of school time programs. And so the health and safety standards that are expected of our out of school time programs are closely monitored by more than 100 licensing staff that we employ at our agency. So it's very important that you verify that EEC status in order to participate or expand participation to those out of school time programs. And as I already said, stringent health and safety requirements, we are actually looking now at unwinding, or what that would consist of unwinding some of our COVID protocols. And what is most interesting for this group's awareness is that the CCDBG requirements out of ACF for health and safety are very much consistent with what pandemic COVID-19 protocols currently are in place for mitigating transmission. Infection control is something that has been required within pre-service of out-of-school time programs pre-pandemic. And so what you will see in a out-of-school time program that is affiliated by EEC is very much consistent with what we would see in an endemic. It is highly, highly adherent to health and safety standards outlined and monitored by our federal partner. Just in protecting districts and getting a lot of outreach, if an out-of-school time program has concerns with participating or would like to participate with a district but has struggled with establishing contact, I have asked that my regional directors escalate those questions or concerns to me directly, and so I will handle them offline. It is not my expectation that any district hear from EEC, an EEC person other than myself, if there was a request for participation. So operationally, we're looking to manage that on the back end so that you all do not receive an onslaught of requests or unverified questions from entities that may or may not be EEC affiliated. And then Russell can just direct us back to this information sharing or questions about this policy gets directed to this landing email page that is supported by DESE and DPH to answer questions.
That's right. Yeah, absolutely. So we hope that we have multiple avenues for people to get to the right source of clarity and information. So thank you, Caitlin. And then just the final slide, Caitlin, about where EEC continues to come in on this to amplify and support this work.
Yeah, absolutely. So I will always be an advocate that our out-of-school time programs be able to participate in these types of programs. I think from an equity lens, it's really important that a family whose child attends before and after school care is not excluded from participating in test and stay. I think it's really important that we honor those children who need care beyond just the traditional school day. And so EEC will be amplifying the messaging around expanding this policy to include out-of-school time programs to its out-of-school time providers. We will reinforce the need for consent forms for bidirectional information sharing. I've joked with Russell, this was decades long needed, right? Out-of-school time programs and districts have needed an opportunity or a vehicle to coordinate bidirectionally for quite some time. Many times out-of-school time programs are, there's transportation involved. There's a lot of matters that would benefit from sort of a consent form or some type of documentation that verifies the relationship between the out-of-school time program and the district. And so we seized on this opportunity as a vehicle to do so. We will also support districts and schools if you need help in identifying who your EEC affiliated out-of-school time program is. I'm more than happy to assist or direct you to our public facing directory, that consumer website that we referenced on that last slide. We will by augmenting that messaging, continue to support our out of school time programs. In terms of implementation, we will also support them in working with their local boards of health or Department of Public Health, and just reinforce the importance of the COVID mitigation strategies and the protocols in place to prevent forward transmission.
Yeah, absolutely. So I think that's all really important for people to know and hear about the ways in which EEC is supportive to really both OST programs and districts, as well as DESE support for this as well for all parties. But the support that EEC can provide in figuring out if a program is EEC affiliated or not, the support that they're providing for the OST programs. So really just trying to get this off the ground with you in a really coordinated way. So Lauren, let's go to questions. I know the one that I see that came into me was about which party, the school district or the EEC affiliated program, the OST program, should be responsible for collecting the consent forms. And, you know, Caitlin, I don't know how you feel about this, but I feel like this is part of what I'm imagining that conversation that occurs between the district and the OST program. I don't think it actually matters who collects it. I think it could be either group. And if the district and the OST program agree that the OST program is going to collect because of, you know, their connection with parents, maybe they're the one that sees the parent coming in or out of the OST program, that could be done. The school district could also certainly do it. At the end of the day, they just need to be, once they're, whichever party collects just needs to make sure that they share the collection of information, the collection of consents between the other party. But in my mind, it really could be either. And welcome your thoughts on that, though.
I agree. And I would just also offer that when out of school time programs asked DEC to be able to participate in this program, they raised their hand and said, we are willing to offer capacity to schools to achieve the consent forms that they need to feel comfortable expanding this program. So I think it is completely appropriate to have a conversation with the out of school time program around how you can partner to sort of divide and conquer in achieving these consent forms, managing them on file. The one thing that I would just raise is that out of school time programs do not have the legal or medical capacity that districts have. They do not, all of them have dedicated nurses on staff that can advise on specific components. So it might be beneficial to continue that bi-directional conversation around what will consist of the consent form, because there may be a level of sophistication that districts can offer in terms of interpretation that out of school time programs will not have.
Thanks. I really appreciate that. And I appreciate the OST program's willingness to help with this as well. We just know that everyone has a lot on their plates right now, including the OST programs, but we can do this together. Well, I'm going to stop sharing, but then inevitably it always leads me to need to go back to a slide. So let's see how we do today. Feel free to let us know what's coming in the questions.
Yeah, actually, so we didn't get too many questions, but there is the biggest question that we did get from a couple of different people is just wondering about the capacity of the schools to take this on, and wondering the ability of CIC to be able to provide more testing providers so that it doesn't fall all on the nurse.
Yeah. So again, I think it's important now that you have this information to decide whether or not it's the right thing, you know, at the right time, right? And so as more younger children get vaccinated, hopefully we'll have fewer students needing test and stay, which would be good news. That's ultimately what we want, is to kind of work our way out of the business of needing test and stay. And so, you know, we're coming into the holidays. Certainly, you know, we just want to make sure that now that we're going live with this, if you want to get started, you can get started right away. I know that, you know, I had a couple of conversations just this week with a district leader about some challenges that they were facing, just really wanting to do this expansion. And so because there was a hotspot, because there were some exposure in an out of school time program. And so this could be that, you know, you just know it's ready. And if you have a hotspot, you can apply it. You could say, we want to do it proactively. We just want to get, you know, those consents done. You could say, let's start in January. But you know, we'll continue to monitor this with CIC and what the staffing capacity is. So I think, you know, really just two key takeaways. One is on you all to decide when is the right time to do this. And the second is on us to monitor the need for staffing. We understand how taxed the nurses are right now. And we really want to make sure that we're doing this in a way that is as sustainable as possible for the rest of this school year.
Great. So then there's a question about who's responsible for doing the contact tracing in the EEC affiliated OST program.
So EEC programs are already familiar with reporting requirements regarding COVID and have established relationships with either the local Board of Health or the Department of Public Health, who provide support on contact tracing. So we don't anticipate that this would fall on the responsibility of the district. What would shift is our requirement or our pursuit of bi-directional information sharing, so that you all get that information more reliably around who is a positive, who has been a close contact, and making sure that there is coordination between both EEC out of school time programs and districts. And I would just reiterate something that Russell had said earlier on, which is the volume of children. We don't anticipate that significantly increasing as of those needing to be tested as a result of this expanded policy. This is really just an opportunity for us to provide additional layers of support or structure around children who may have already received contact, that they're close contact of a positive case, but have not been able to participate in test and stay. So we don't believe this to be a tremendous increase in volume of tests that will need to be administered, but I appreciate Russell's commitment to looking through the implementation of this to make sure that we can reflect on staffing needs incrementally, or, as needed.
Yeah, absolutely. And I think along with that, the idea that by doing this, it's not always automatically meaning that the volume of testing is going to go up. It means that we're creating that clear pathway for students to be able to participate in out of school time programs, which we know is just, so important for their health and safety, and the support for families as well.
Great. Russell, this is not a question, but someone is asking for you to reiterate that students who are participating in test and stay can still ride the bus, either from school to home or school to the EEC affiliated OST program, even if they're participating, so long as they remain asymptomatic.
Yeah, and I think it's a key tenet of test and stay, is that test and stay does not have to happen. The testing of test and stay, that daily by next now, doesn't have to happen at the beginning of the school day. And so, and really, I think another important point that I know Caitlin and I have talked a lot about with DPH is that not only can the student, yes, ride the bus to school, to and from the OST program, but they can attend the before school program and then get tested in school. Because the idea of test and stay is that we're monitoring every day during a 24-hour period. And so it's not a matter of, are you tested at the beginning of the day, but are we testing within an approximate 24-hour range for those continuous number of days that the student needs to be tested for, the 7 days, which usually works out to 5 plus whatever has to happen after a weekend. So I think that's why it's okay for the student to ride the bus to school, why it's okay for the student to participate in the before school program, and to come into school, and then during the school day at some point have that by next now occur. So I hope that's helpful as a kind of a larger reminder, because I have heard recently even just a few people get off track a little bit with that and say, students have to be tested before entering the building for test and stay. And that's actually not factually true. If you can do it, great, but you don't have to.
Great. We don't have any other questions that need to be answered here. So I was putting the slides into the chat. And our documents, both the policy memo and the addendum to the consent form, have already been posted to our website. And so I will just put that link in the chat once more for people to grab.
And Lauren, I think it's always important to note that the consent form is translated. Do you want to just speak to that for a second?
Yeah, so we've translated the consent form into the top 6 languages spoken in Massachusetts. And so there's a link and you'll find all 6 of them there.
So much. Well, everyone, thank you for your time. Caitlin, any final closing words?
No, just thank you for the time. It's really a great opportunity to be able to connect with the districts. So thank you for the opportunity to do so, Russell and Lauren.
Absolutely. Thanks so much, Caitlin. Thanks to all of you. Have a great weekend. We look forward to seeing you again soon. Take good care.